I am Bhik Kotecha and I'm an ear, nose and throat consultant surgeon. I have been a consultant since 1995 and my NHS base is at the Royal National Throat, Nose and Ear Hospital in central London and Queen's University Hospital in Romford in Essex. I practice privately at the Nuffield Health Brentwood Hospital. My expertise covers all diseases of the ear, nose and throat. However, I have a particular interest and specialization in problems of snoring and the condition called obstructive sleep apnea syndrome. Well, sleep apnea is due to a problem with upper airway obstruction, and the obstruction can arise from the beginning of the air entry port, which is the nose, all the way down to the tongue base, hypopharynx and larynx. So usually what I see is a multi-level obstruction of the upper airway where you have bulkiness of the tissues around the throat, the soft palate and the tongue that causes the obstruction in breathing.
About 4 years ago I started to realise that my husband at night time was having interrupted sleep with snoring, and it became so disruptive that I would wake up constantly. I'd wake up to a big deep snore and he would hold his breath, and I'd count and I'd wait and it wasn't coming, and I'd have to nudge him, and then he'd take a big deep breath and start breathing again. So when the diagnosis was finally made and we were recommended to see a chest physician and consult with them about the diagnosis, at that point Jim was offered the sleep apnea mask, which he found very difficult to tolerate. Mr. Kotecha recommended various options for the treatment, one of which was surgery. And that was the route that Jim and I decided to go down. Since the surgery, it is like chalk and cheese. Both our lives has changed dramatically. Jim is getting an undisturbed night's sleep, and it's a quality of sleep that when I do wake up occasionally, I know it's a restful sleep. The surgery performed by Mr. Kotecha has been